Hello everyone, I'm Sahana. I belong to PGPBM 1921 batch. My roll number is 1903034. Today I'm going to talk about the healthcare infrastructure in India. India has shown a phenomenal progress in the healthcare services since independence. It is reflected in the increased number of hospitals and doctors and test laboratories, healthcare workers, etc. If we also look at the indicators of Indian economy since 1951, in the past 70 years, it shows a tremendous record. The infant mortality rate has reduced from 183 in 1951 to 32 in 2020. The life expectancy has increased from 33 years in 1951 to 70 years in 2020. The maternal mortality ratio is also around 140 to 1 lakh in 2020. All these measures show a tremendous improvement with respect to the healthcare infrastructure. India has also shown control in communicable diseases like malaria, smallpox, and the measles and AIDS to a vast extent, and the immunization record for mother and children has been achieved in a record of 100%. Let's look at some of the bottlenecks pervading the India's health service delivery. The first one is the gaps in healthcare infrastructure. To provide universal access to healthcare, we need to first fulfill the gap in the healthcare infrastructure. Even if the private sector caters to around 70% of India's population, there are still very low levels of healthcare facilities, like 1.3 hospital beds per 1,000 people in the country. The second reason could be inadequate public funding. So the public health expenditure is still very low in India. It's little more than 1% of GDP. The third reason could be high out-of-pocket expenses. Poverty is still a major issue in India, and around 3/4 of India's population live below poverty line. In such case, around 80% of the ambulatory care is provided through high out-of-pocket expenses, and this causes the people, the majority of India's population, to live in poverty and debt. The other reason could be the shortage of skilled professionals. So as per the WHO benchmark, there should be around 1 doctor per 1,000 people in the country, and India is still far behind this WHO benchmark with around 0.65 doctors and 1.3 nurses per 1,000 people in the country. So with this statistics, India requires around twice the number of doctors and thrice the number of nurses and quadruple times the number of paramedic and support staff. Other reasons of the bottlenecks, evasion, could be the non-availability of drugs and also the poor mechanism of the healthcare delivery and other stuff. Let us look at some of the steps in removing the bottlenecks of healthcare service delivery. Some of the steps to be taken to remove these bottlenecks are universal health coverage. The UHC, in its simplest definition, means all the people in the country should have access to quality, effective and affordable health services without imposing financial burden. The government should institutionalize UHC in a way to eradicate the barriers to good health and access to all the people in the country. In its UHC model, all the citizens are entitled to a comprehensive package of healthcare services where they have access to public health and accredited private facilities such as diagnostics, medicine, vaccine, surgeries without having to pay at the point of use. The other way would be strengthening the primary healthcare services. The primary healthcare should be the major priority, and if this is implemented in a better way, there will be substantial reduction in the need of secondary and tertiary health. So achieving a target of Ayushman Bharat, it needs to establish around 1.5 crores of wellness and health centers in our country. In India, the health research activities related to the public health expenditure, they are completely not related to the public health outcome. So the more emphasis should be given on evidence-based health research policies and the research which is actually being conducted. The next step is to increase the public health spending. As we have already seen, the current public health spending is close to 1% of the GDP, and this has to be increased. As per the National Health Policy of 2017, the government expenditure on health should be increased to 2.5% by 2025, and this should soon become a reality to achieve a better health outcome. And also, since poverty is a major issue in India and 3/4 of the population is living in below poverty line, we all need access to free drugs, at least for the critical drugs which is given. The next step is the human resource for health. A national human resource institute for health should be set up, which will address all the concerns related to the health policies, and it will monitor its governance and mechanism. To finally conclude, the priorities should be changed, taking into consideration the majorly affected people and the vulnerable section of the society, and their health issues need to be addressed. And the need of the hour is that the policies should be framed by the national and state government, the civil society organizations and people health movements, and also they all should change the way in which the health policies are organized and funded. Let's all work towards the betterment of our society. Jai Hind.